Hi, my name's Louisa, and I'm a harm reduction health educator at MaineGeneral. This video series covers routes of use, and today we'll be learning about boofing, which is sometimes called booty bumping or plugging. First, we'll learn about how the boofing high works, and we'll talk about some commonly boofed substances. Next, we'll discuss some of the risks associated with boofing, and I'll provide some harm reduction strategies. So, boofing is when you consume a substance by inserting it in your rectum or vagina. Many people boof by removing the needle head of a syringe and injecting. When a substance is boofed, it's absorbed through the thin lining of the rectum or vagina into your bloodstream. So you can feel a high as soon as 5 to 10 minutes after using. Timing to feel the effects, of course, of any substance really change based on how much is used, what kind of substance it is, and the body of the person using it. Some commonly boofed substances are alcohol, pills, meth, heroin, coke, crank, speed, and more. So people might boof substances in order to avoid some of the risks associated with other methods of use or to maximize the effects of a certain substance. But there are some risks associated with boofing. Boofing introduces a large amount of a strong substance into your bloodstream without letting it go through the filtering processes which happen when a drug is swallowed. So what this means is that a substance's effects will be much stronger and more dangerous when boofed than when taken orally. This itself really increases the risk of overdosing. It also means that the high will probably be shorter. This is true of all non-oral swallowed routes of use too, like injection, smoking, and snorting. Additionally, just like with injections, there is a risk of getting Hep C and HIV from sharing materials when boofing. Specific to boofing, some risks are damage to the rectal or vaginal wall, a higher chance of contracting sexually transmitted diseases or infections, they're sometimes called STDs or STIs, blood and poop, Hep A, rectal or anal cancer, and some other infections. But you can reduce these risks by using the low and slow method, practicing appropriate hygiene, taking care of your rectum or vagina, and alternating routes of use. Since you can more easily overdose when boofing in comparison to swallowing something, try to use the low and slow method. So you should start off boofing a small amount of a substance, wait a good chunk of time before taking more. You can always take more later. Even if you know how a pill is going to affect your body when you swallow it, the effects will be different and a lot more intense when boofed. So make sure to take less of a certain substance than you usually would if you were going to swallow it. And always be sure to have Narcan on hand and a friend nearby in case of overdose. Even if you don't think you're taking an opioid, many drugs these days are unfortunately laced with fentanyl, so you can still overdose. But a friend nearby can give you Narcan to reverse the overdose and save your life. Hygiene is also really important when it comes to boofing, because it really reduces the risk of infections like Hep C, HIV, Hep A, and other STDs. You should always try to wash your hands before and after boofing, and avoid sharing materials if possible, because again, these can help spread those infections I just mentioned. Instead, you should always try to use your own syringe and waters when you're boofing. Also try to use new materials each time you boof, because germs can live and grow on used syringes even after they've been washed. These germs could lead to infections if the syringes are reused and inserted back into your body. To minimize the damage to your skin, try to always dissolve your substance of choice with sterile water and fully remove the needle on a syringe before you boof if you're using a syringe. Also, try to lube up your syringe, rectum, or vagina before you're boofing. The skin lining the inside of your rectum or vagina is really delicate and sensitive. Drugs themselves can burn the skin, and chunky, jagged substances can tear at it, as can dry boofing without lube. This damage is really painful, and it also makes it easier for drugs to get to your genitals if you have unprotected sex or share boofing materials. These germs can then cause infections like Hep C, Hep A, HIV, chlamydia, gonorrhea, herpes, and syphilis. Finally, try to rotate routes of consumption. If you can, try to avoid continually boofing without letting your body heal, because this could irritate the area even more and lead towards greater forms of infection. Additionally, long-term boofing has been linked with colon, rectal, and anal cancer. So try consuming substances in a different way after you boof. You can check out our videos on other routes of use in MaineGeneral's harm reduction YouTube playlist. Thanks for joining me today. We learned about how boofing works, drugs which are normally boofed, risks associated with boofing, and some harm reduction techniques. At Next Step Needle Exchange, we offer a variety of supplies, including lube, sterile waters, syringes, Narcan, and condoms. These materials help create a safer environment for drug use, reducing the risk of infections and other complications. Thank you for joining me today, and I invite you to check out more of our content on MaineGeneral's Harm Reduction YouTube playlist.